Now, speaking of disparities and the bigger picture, we have a special presentation to help link the global AIDS epidemic with the local story here in the U.S. and here in Atlanta. Please welcome Reagan Hoffman from the International Association of Providers of AIDS Care. Please welcome Jose Nzinga.
Good morning. It's a pleasure to be here with you. I'm actually from UNAIDS and Jose is from IPAC. I want to thank Douglas for your extraordinary leadership and for inviting me to be here with you today, and for the White House for having me here, and Dr. Rice for having us at Morehouse this morning. I'd also like to extend the best wishes of UNAIDS Executive Director Michel Sidibe, who sends you his warm greetings and congratulations on the updated strategy. He's here with us in spirit. I'm honored to be present after 20 years of living with HIV. It is always a pleasure to be in a room with so many people who have helped save my life and the lives of millions of people around the world. And it's particularly poignant for me because I was infected with HIV in Atlanta. So to come here today on this occasion is personally profound. Speaking of profound moments, we're in one in the epidemic. We know this. Recently, we have announced that the MDG 6 goal of halting and reversing the AIDS epidemic has happened. We have met this incredible target. We have also met another important target, putting 15 million people globally with HIV into care. That's something that many of you in this room, most of you in this room, have had a large hand in, so thank you very much. We also did it 9 months ahead of schedule. I remember when that goal was set and people thought, this is crazy, this is audacious, this is never going to happen, and we did it early. So in a moment of setting new targets, I think it's important to remember that we can meet them, and we do. The rate of new infections has fallen by 35% since 2000. Among children, the decline's been 58%, and recently, very recently, the WHO announced that Cuba has been certified as the first country to totally eliminate mother-to-child transmission of HIV. There have been some really promising breakthroughs in vaccine and the cure. We're not there yet, but we are making headway, and we know where we're looking today. And basically, we have a historic opportunity to actually end the epidemic as a public health crisis by 2030. We have to meet certain targets by 2020 in order to do that. They are in 3 categories: the prevention target of no more than 500,000 new infections by 2020, the treatment target of 90% of all people with HIV globally being aware of their status, 90% of them being connected to care and on treatment, and 90% of them being durably, virally suppressed. If we do this, and we achieve the final target, which is eventually zero stigma and zero discrimination, something that we're all working hard towards, we can see the end of this epidemic as a public health threat by 2030. But we know there's a lot more work to do. 36.9 million people with HIV globally, 22 million need treatment, 19 million don't know it, 2 million are kids. So we have a big gap, but having done the work that we've done lately and made up the amount of people in care that we have made up recently, I think it's not an inconceivable goal. The barriers are huge. We all know them: stigma and discrimination, the criminalization of people with HIV, health care infrastructure challenges, health force work challenges. We need the vaccine, we need the cure, we need a bunch more money, and of course we need sustained political will, which has always been a landmark of this response. To overcome these challenges, we need to accelerate the pace. We need to get an urgent response in place in this moment. And we need to put the resources, as Douglas said, where they're going to be most effective, behind the people and in the places where they will have the greatest impact. The U.S. has led this charge for a long time. It is still leading the charge around the world. It's leading it at home. And on this audacious day when we release an updated strategy, I think it marks a new era in U.S. leadership in the AIDS response, signaling that we just don't lead around the world by funding the response, but also we lead by example at home, by making a greater attempt to fix this epidemic in the U.S. So thank you very much to all of you for all the work that you've done, and I turn it over to Jose to talk about how this will happen here.
Thank you very much, Regan, and thank you to President Obama for his leadership both in the global and domestic fight against HIV and AIDS. We've accomplished tremendous things thanks to his leadership. Thank you to Douglas and the Office of National AIDS Policy for carving out some time here for us to discuss the Fast Track Cities initiative, which is an attempt to bridge the distance between cities with high HIV burden to accelerate local HIV responses to attain 90-90-90 by 2020. We are very fortunate to partner with more than 200 cities currently, 46 of them high HIV incidence cities, including 3 here in the US, Miami, San Francisco, and today we announced that Atlanta has joined this network, as well as global cities of Amsterdam, Bangkok, Durban, Mumbai, Salvador Bahia in Brazil, and Port-au-Prince in Haiti. This is a partnership between the cities which are leading the initiative, IAPAC, the Joint United Nations Program on HIV/AIDS, UN Habitat, and the city of Paris, which was the first city to sign the Paris Declaration, and as many of you may know from history, issued the Paris Declaration many years ago around the involvement of people living with HIV/AIDS in the global response. The Fast Track Cities initiative is aligned with a global strategy to end the AIDS epidemic by 2030 as a public health threat by focusing on key locations and among key populations and addressing the disparities that Douglas, the President, many others have spoken about this morning. When a Fast Track City signs the Paris Declaration, they commit to a set of commitments to facilitate these actions, putting people at the center of everything we do, addressing the causes of risk, vulnerability, and transmission, using our AIDS response for positive social transformation, building and accelerating an appropriate response to local needs, mobilizing the resources necessary for integrated public health and development, and uniting as leaders because we all have a stake in this fight. With that, I'm very pleased to introduce, representing Mayor Kasim Reed, Commissioner Yvonne Kauser-Yancey, who is Commissioner of Human Resources for the City of Atlanta. With 18 years in the human resources field, she leads the human resources functions of the City of Atlanta, impacting 7,500 employees and 5,000 retirees. Commissioner.
Thank you so much. I'm pleased to be here with you today. Mayor Reed, unfortunately, is traveling, cannot attend this event. I want to thank our host today, Director Brooks from the White House Office of National AIDS Policy, Dr. Rochelle from the U.S. Department of Health and Human Services, and a special thanks to Dr. Montgomery Rice and the Morehouse School of Medicine, which has been an essential part of the City of Atlanta since its inception 40 years ago. The City of Atlanta is the 7th largest city in the United States, and we're very proud of that. We're also the #1 city in the U.S. when it comes to the rate of new HIV cases diagnosed. This is an issue we'd like to resolve. We're not very excited about that ranking. We want to change it. And that is why Mayor Reed considers HIV/AIDS a significant public health threat to the growth of the city and the quality of life of our residents. And that's also why we signed the Paris Declaration. We are so thankful to have so many outstanding clinical and community partners in the metropolitan Atlanta area. There's exceptional work happening at Grady, Emory University, Morehouse School of Medicine, the CDC, Sister Love, and a host of other community organizations that we can name. We must leverage the local leadership and the passion, along with the national and international technical support this initiative's core partners bring to the table to end AIDS as a public health threat by 2030. We'd like to thank IAPAC, UNAIDS, UN Habitat, and the City of Paris for believing in Atlanta and inviting us into the League of Fast Track Cities. And we look forward to bringing in other major U.S. cities to this dynamic partnership. Mayor Reed and his administration are committed to work shoulder to shoulder with clinical providers and service providers, but really working with people in our community who are living with AIDS. Thank you for all the work that you do. We really want to highlight that. We think it's so critically important, regardless of socioeconomic status, race, gender, sexual orientation, that all of our community members receive the quality of care and support they need to work through this disease. So thank you for what you do. I hope today's program and subsequent strategies that are developed today continue to drive the change we need within our communities. Thanks so much.